Now, I'm going to imagine, Katie, that in your clinic, you have a lot of people who are carrying a lot of, like you said, shame is a very dense emotion. I'm going to guess there are a lot of people who think, why did this happen to me? What did I do to cause it? And so how do you respond to that? Like, do we cause our own sicknesses? Like, what would you say to someone who said that to you?
Yeah. Well, this is very common. So, and it's honestly the question that most of my patients want answered is, how did this happen? And why did this happen to me? I have no family history. Cancer's not in my family. And I'll say that most cancers are not genetically related. Okay. So, like, I treat breast cancer, and only 5 to 10% of all breast cancers are related to a gene that is responsible for the cancer. So 90 to 95% are sporadic, meaning that it just happens. Mm-hmm. And the second part of your question is a little bit loaded because what I tell my patients, so I'm going to tell you what I tell my patients, and then I'm going to tell you kind of some thoughts that I have that I don't know 100% the answers, but I ponder and I'm wondering about. The first is that I tell my patients that it really doesn't matter. It doesn't matter why we're here right now. What matters is how you manage through it. And that what they're often worried about is that they ate something that, something in their diet or something, and they're beating themselves up over all of the things that they possibly could have done. And that is not helpful, right? So it's not helpful to beat yourself up to try and find the cause so that then you can, and people get then obsessed. Like, so one of the episodes on my podcast was about this with food, where one of my patients came in and her sister was like, she's now obsessed with, she won't eat anything. Basically, she's eating nothing because if you look on the internet, you'll find everything causes cancer. And I've been practicing for now, between residency and my practice, 20 years, that I'll tell you that the pendulum swings on diets, and like, this diet causes cancer, and then now this causes cancer, and then that did last year, but now that does, it's like all over the place. And so what I tell people is general good eating habits of eating whole foods, not processed foods, avoiding sugar. Those kinds of things are like generally good habits. But getting hyper focused on these causes is another way to beat yourself up. And frankly, in healing, fear is going to block healing. So fear and worry and kind of this contraction is going to affect your immune system and not allow your body to heal. Whereas being in love and support and like really loving yourself is the best place that you can be to allow healing to occur. And so what I encourage my patients to do is to be so compassionate with themselves. Like, how would you treat your sister or your husband or your child if they were dealing with this? Certainly, it's not the way that we normally treat ourselves. And so really having this compassion and love for ourselves. So that's what I tell my patients. Now, do we cause illness? I think there are things with emotions and things that can happen in our life from stress, trauma, emotions that definitely can contribute to illness, physical illness. And actually, if you just simply look at stress is a major contributor to disease. And that there are, some different theories around potentially emotional trauma and certain types of experiences that may lead to physical illness in the body. And so I do believe there is that component. Do I subscribe to saying like there are some practices where they totally say you shouldn't do any therapy because it's all emotional and you process that and then that's it? I don't subscribe to that. And I think part of it is, as a cancer doctor, that there's a lot of liability there, right? Like, I really believe in a holistic approach. And I do believe that using all the resources that we have. And so I don't subscribe to something where they say all, illness is completely emotional. Don't use any Western therapy. So that's that piece. But even if, say that there's an emotional component, the way that I would talk about with my patients is to ask, do you have, like, has there been a stressful event or an emotional trauma that you're holding that we can help you release, that can help you, right? Because again, you don't want them beating themselves up. Oh, it's because I was like stressed about this, whatever, it's like, it's all about empowering. And how do we give the person who's dealing with, in my case of physical illness, the power to start healing themselves? And all of that starts with love and compassion. And the more you can really feel worthy, loved, that's a basis of health,
we're talking about this, of course, and the examples that you're giving are from your clinic and the people that you've treated, but this is just life. This is how we should all be treating ourselves. And I know I listened to your podcast religiously, and please, if you haven't already, check out Katie's podcast because it is absolutely phenomenal. And right now you're producing 2 episodes a week, right?
Now I'm down to 1.
You're down to 1. But regardless, it's phenomenal. And I would listen to 2 of your recent episodes that I'd love for you to share some of what you shared in those episodes. So the first one was about self-love. And it's one of the things that you just talked about, that we really need to be coming at ourselves from a place of love. So could you share a little bit about what you said in that episode about self-love and how do we go about loving ourselves? Something you said in that episode, which I'd never thought about it, but when you said it, I was like, oh my gosh, is that we're never taught to love ourselves. We've never been given that lesson, right?
Yeah. Yeah. It's so interesting because we're born, and most of us are born into families where the parents like love us beyond, like, just they're in love with this baby that they bring into the world. But then because of our social, cultural conditioning, as parents, and now this all for me is quite recent, and my children are, my youngest is 11, the oldest is 21. So they're like, I did the damage person, but the stuff when they were little that now I'm like, oh, if I could go back and do it differently, but it's all perfect. They're having their journey and it's all going to be okay. But we bring them into the world and we love them so much, but because of all of the social and cultural conditioning, we don't teach them how to truly love themselves, because we teach them to do things that are appropriate for our family, for our culture, for their schooling, for the religion, whatever, all the constructs that we live in. And so there are things that, and they're little, and we don't realize that as parents, they are teaching children to start to ignore their own internal signals. And self-love really comes down to honoring your internal guidance. We all are born with these subtle signals that tell us what feels right and what feels wrong for us. And that is really foundational in being able to have self-love. And so with a child, they might say, okay, go give your uncle a hug, like that you've never seen before, right? But because it's like for the family. And so this child learns at a very young age, that doesn't feel comfortable. I don't want to do that, but something must be wrong with me for feeling wrong because my parents are telling me to go do this. So there's little things like that that start to erode our own signals and our trusting of our own internal signals. And I think that this is just common in every culture, because we've got these accepted behaviors, right? And so you're taught to live according to the norms of whatever family that you've been grown up in, or that you've grown up in, that the school or religion or whatever, and less about how do you really listen to yourself and honor what you want and what feels right to you. And so as we get into this phase of where we're adults and we've been conditioned to do all these things, we actually lose touch with who we really are at our core. Not intentionally, our parents didn't mean to disconnect us, but just this happens over time in modern society. And so for me, the where I really learned this was through the book Love Yourself Like Your Life Depends Upon It by Ravi Kant is Kamal Ravi Kant, I think is the author. Yeah. And it's a short book. It's like 50 pages. I think the revised version is like 250 pages. But if you read the first 50 pages, you've got the gist of the book. And there's exercises in there. And he's a Silicon Valley CEO who ended up being like super sick. His company went belly up, and he had a girlfriend who left him, and someone died all within like, a couple months. And he was just beside himself and really out of sorts. And he made this commitment that he was going to love himself and learn to love him exactly as he was. And it was life-changing. And now this is like his, platform. And so I read that book and I did the exercises in that book. And I really found that it was so missing in my life. And it's something almost, I feel like self-love is a lifelong project, that even if you did that book and you did all the exercises for a year, I think that it's something we always can work on, and really just acceptance of who we are, because each one of us is so unique and has different gifts to offer the world. But when we've been conditioned to look like everyone else, do what everyone else is supposed to do, we're not really in touch with who we are and able to show up in the world with all of our gifts. And so self-love is really foundational. And there's one thing that I find that I do the exercise, the mirror exercise that he recommends, except for I do it a little different. So he recommends that you go in a mirror and you like get really close up and you gaze into your eyes and tell yourself you love yourself. And honestly, that was very hard for me. I was like, this is weird. And he says like the things, you don't have to believe in them, you just have to do them. But what I found is that an easier way for me to connect with it was, and I learned this through a stylist actually who uses self-love in her styling, Alma Barrero. And but doing a full body scan where you start from the head. And so I would look at my hair and say, I love you. And then my forehead, I love you, my eyebrows, my eyes, my eyelashes. And all of a sudden you realize, holy cow, look at all of this that I have, and I do it with my patients for internal organs as well, because like your throat, your lungs, your lymph node, your whole body is like a miracle. And doing that mirror exercise of going piece by piece of parts of your body is so powerful, because you start to recognize what you take for granted and what this body is really doing for you every day of our life that we just lose sight of. So
we're so focused on the negative, right? Like my butt's too big, my boobs are too small, whatever the thing is. And yet we really don't appreciate the miracle that is our body, right? All of the things that are going on all the time. And related to self-love, another episode from your fantastic podcast that I listened to was about self-care. And I know self-care has become like a buzz thing on social media. And, generally when people are talking about it, it's mani-pedi and spa and things like that. But you gave such a great acronym for that. Can you share that with us and what each of them is?
This is so funny. I'm like, oh gosh, I should have listened to my podcast because I can't. What was the acronym for the self-care?
Yeah, you need to listen to your own podcast, Katie. It was fresh.
For self-care, the way that I talk about it with my patients is that I think people get confused about self-care because they think like it requires me to go do something or like buy something or whatever. And it's so basic that self-care is really looking at yourself as if you were taking care of someone else. Like if you were taking care of someone else, what would be the things that you would do to make sure that person is really cared for? And so, for me, the biggest thing that I think we overlook is rest. That's the biggest thing that I see in our society is rest is not a value. Like overdoing is a value. And so the first thing that I tell people is rest is not only, S is sleep. Rest is, finding time to just be quiet and doing nothing. And this is really has been a new one for me. Before we started recording, Sandra and I were talking about that I just went part-time in my work, and I've been working full-time, my whole life. But I've been practicing now after finishing all my training for 16 years. And resting is really weird. I was like,
oh yeah,
resting, like what? That's not a value that I've been taught. I've been taught to achieve, to do, to all these things. But actually, like this is one of the most important things that you can do is just finding time to like do absolutely nothing and just resting and, creating space. And one other thing that's really interesting for me, and this is, relates to kind of shifting gears for me and creating more space, is that I've started to release things. So like I just 2 days ago, I had a beautiful Tesla. I loved this car. Like I'm not even a car person, but like I got a Model 3 like a year ago. And I was like, oh my gosh, this car is just like beautiful and loved it. And my son went away to college 2 months ago, and we had 3 cars and we only had 2 drivers. And I had purchased the Tesla, but I had leased his Corolla. And so I was like, I have to get rid of a car. And I was like, oh, I don't have a choice. I have to keep the lease because I'm contracted on that one. And so I had to let go of the Tesla. And I really was attached to that car. I realized that when we listed it like 4 weeks ago, I was like so attached to this. But that was part of that lifestyle of like the money and the doing and the achieving and having the stuff. And even though it was super nice, it actually made me feel abundant and I loved it. I was so sad the day that, like, this was 3 days ago, I watched the new owner drive my beautiful car out of my driveway. And then I have this Corolla that actually, by the way, is like dirty and gross because an 18-year-old had been driving it and like not caring for it. And I was like feeling kind of so down and sad about it. And then a day later, I felt 100 pounds lighter driving it around in this dirty old Corolla because all of a sudden I had created space. I now don't need to work to afford this payment. And so I tell that story just because I think it plays into this whole thing about self-care, is because if you think about self-care as things you have to buy and things that are going to make you feel abundant, but you're paying for them, there's a cost. And so what I'm doing right now is, and actually after I did that, I'm like, what else can I release? What can I sell? Like, what can I, because as we start to create space and release the things, it's so soothing for us, like for your whole being. We really don't need all the things, and frankly, I'm realizing the less things I have, the more at peace that I feel and the more rest I can have. And my body is just like, I've been sleeping like, 14 hours a day because I could take a nap. I've been on vacation for a couple of weeks and just allowing myself. And so I don't know that I've totally answered your question about the fresh with the self-care, but I think that self-care is not necessarily what we've been taught it is. It's really breaking down to the basics. And the things that I've been focusing on is resting, eating whole foods and eating, in ways that are nourishing to my body, making sure I'm getting good sleep. And then the H is happy. So really doing things that make me happy, like what makes me happy. And I like to draw and color with my daughter. So like we cleared out, one of our our little rooms where we had like art supplies in the dining room, cleaned out the shelves and just made all the little art supplies, like, made it really sparse and just the few things that we love to use. But like, that just makes me feel rejuvenated, is to do those little things that make my heart sing. And so that's one of the things in self-care as well, is what do you love to do? Like, not because anyone told you you're supposed to do it. The things we think we should do for self-care, it's like, that is a bunch of BS, right? And so finding the things that really make your being feel happy and lit up.
Katie, you are such a delight. I just adore you. I want to ask you one last question. And I know that you are someone who believes in the power of our mind, the power of our words. And so I'd like for you to finish this sentence for me. I am
powerful.
Yes, you are. Yes, you are. You are. And I am so grateful to you for giving us this time. I know you're in a time of transition. I know that you're working on so many amazing things that I'm so excited for you to share with the world. Where can people find you? Where can people follow you? We will absolutely link to everything, but can you tell us, where can people find you, the name of your podcast?
Yeah. So the name of the podcast is Born to Heal with Dr. Katie Deming. And that's on, all of the places that you can find podcasts. I am on social media, but honestly, I have not been really present there because of my life. And so you can follow me at Katie. I think it's at Dr. Katie Deming, but there's not much there except for the links to my podcast. I'm hoping to change that in the near future, but for now, that's where you can find me. And also my clothing brand is called Make Merry.
Why was it? I wanted to ask you that real quick. Why is it called Make Merry, which seems an interesting name for a brand that's focused on women going through a challenging time?
Yeah. So there are two parts of that. One is that it was made with love. So like, it's a maker's brand. And then Make Merry, it's, really to bring joy. The whole purpose of that brand is to bring joy into people's lives in a time where they feel really uncomfortable, and that it's also okay to feel good, because I think there's a lot of messaging within, we started just within the cancer space and now it's for sensitive skin, but there's a lot of messaging in that space that like, you're supposed to wear these ugly medical bras. And like, this brand is really about the opposite of that. It's like, hell no, like, you should wear something that's beautiful and makes you feel good and happy, and I design the bras. So like, it's what I wear every day. I have sensitive skin and it's like, they're designed so people want to wear them because they're cute. Oh, and by the way, they're super comfortable and they're going to be exactly what you need if you have sensitive skin. So that's really what that brand is about, feeling good no matter what you're going through, and that women deserve that.
So that's Make Merry, and it's makemerry.com where people can...
It's Shop Make Merry.
Shopmakemerry.com. And I just want to emphasize, it is not just for people going through cancer, that this is...
Yeah, for any woman who hates bras and like has sensitivity. They're really light support though. So it's not, if you want like super supportive bras, this is not your thing, but it's like light support, just super soft against the skin, no stitching that touches the skin.
You are truly a delight. I am so grateful to call you a friend, to call you a mentor. And I'm so grateful to you for spending time with us today. Thank you so much, Katie. Thank you.
Oh, thank you so much. And I am a huge Sandra fan. So all of you are so lucky to be in here learning from her, because she is truly a gift and a light in the world. And so it's my privilege to have been here. And it is 100% an honor to call you a friend.